Hi, my name is Ryan Day, and I visited the Department of Health and Human Services, also known as the DHHS, for my field visit. We met with Christine Farnan, who agreed to let us ask a few questions about the industry. Christine's role at DHHS is a Regional Health Promotion Advisor, meaning that she overlooks programs and policies by the department at a local level. Before our interview with Christine, I was feeling slightly nervous as I had no idea about how formal our interview was going to be, considering that it was a government organisation that we were visiting. I was also concerned that some questions would not be able to be answered due to confidentiality. I also felt confused at some points of our interview and slightly bored, as there was some terminology I did not understand and seemed to be overly complex. On the other hand, I really liked the handouts Christine gave us. They were really well written and easy to understand. Throughout the duration of the interview, we became less nervous as it was more of a conversation rather than a formal interview. My general thoughts on our meeting were positive, and I found many of Christine's stories to be interesting. I was also impressed by her work, which is focused mainly on obesity. The experience was good, as we gained a huge amount of information. This included partnerships with the Department of Health and Human Services and programs run by the organisation. I learnt that Vic Health is a key partner of the DHHS as they provide funding towards their campaigns. Other partners included local councils and smaller agencies. One thing I found interesting was that the DHHS does not use a partnership framework, but rather collaborates with partners on a more complex level. Christine said that the partnership framework was too simplistic, which made me think that frameworks are not always practical in every situation. One of the programs run by the department is called Nutrition Network Eastern Region, which aims to reduce intake of sugary drinks and increase consumption of fruit and vegetables in the Eastern region. Christine gives us information on the program and told us that Maroondah Council alone had the highest rate of daily sugar-sweetened beverages in the region. This is one of the handouts that she gave us. This made me think that although there is great planning going on in this area, more action needs to take place in order to see change. This is often dependent on funding for programs such as Nutrition Network Eastern Region. We also discussed stakeholders and capacity building in regards to the DHHS. Christine also provided a handout showing stakeholders of the organisation between a national and local level. I learnt that stakeholders are identified using the program logic model for stakeholders. Christine mentioned that it is used to help identify stakeholders who are not necessarily in the field of health promotion. The department also uses the public participation framework, which allows the organisation to evaluate public engagement. In regards to capacity building, the organisation uses the New South Wales Capacity Building Framework, as this drives responses at different levels of capacity building. Christine told us a story that really stood out to me about how she knew a nurse and one of her patients needed a CAT scan but was so obese that she could not fit in the machine in the hospital. The patient had to be transported to the Werribee Zoo to use the CAT scan for large animals, and the whole trip cost $35,000, which really shocked me. This just demonstrates to me the importance of prevention in health promotion, as this whole situation could have been avoided. On reflection of this experience, I have gained much knowledge about the many job opportunities within the department. I've also learnt that in the future, sugar intake will be treated like an addiction, such as smoking, as the obesity epidemic in Australia is only growing. I think we could have possibly asked more questions from a nutrition perspective rather than a general perspective, but we did not know that Christine was so interested in obesity and nutrition. I should have also asked more questions regarding aspects I did not understand. I think if we were to do anything differently, it would be a more structured interview style rather than a conversation. This was hard because Christine was so passionate about her work. She would go beyond answering the questions that we asked. Thanks for listening.